Thank you very much for joining us. We're really excited to have you today, have you join us and talk through some of the programs and the theory around male engagement and kind of where we are right now in this field, talking a little bit about timing and how that kind of plays in a lot of different ways. I'm going to hand it over to Bianca for a moment, and she's going to walk us through a few slides about the logistics of today's session, and then we'll get started. Okay, Bianca?
Great, thank you. So yes, just to let you know, we will be live streaming on Facebook, and also we have Wordly available, which is an artificial intelligence. So it's an AI generated translation. So if you'd like to hear or watch closed captions of what's going on in a different language, you're able to click on, you'll see at the top of the screen on the left-hand side, it says live on custom live streaming service. You'd click on the arrow, and then you'd click on view stream on custom live streaming service. And that will then, if you would go to the next slide, please. That will then take you to Wordly, and then you can select whichever language it is. There's 18 languages available. You select the language most appropriate for you. And what you can do is sort of share the screen so that you can have the Wordly captions on the one half and the picture of the speakers on the other. We do also suggest for everyone that you go to the view and select speaker view, and that way you'll see the panel who's speaking rather than everyone that's in the room. And if you could just go to the next slide, please, Dominic. You can follow us on Twitter, the Ubuntu Symposium hashtag, or Symposio Ubuntu. And then the final slide, if I'm two more slides actually, is that we also have the Ubuntu Symposium app, which is available, and we will be sending out the link to everyone that has registered. So if you are interested in joining any of the other sessions or seeing the recordings or joining discussions, you can do that. And then lastly, thanks, Dominic, is that if there are any technical questions, just please ask in the chat and we will try to help you as quickly as possible. And then back to you, Dominic. Thank you.
Yeah, thanks so much, Bianca. And you know, these events are a lot of different people and activities and responsibilities. So thanks so much for helping us get this off this morning and setting up the event. And so here we are with timing is everything. And so this is the time to start this event around male engagement. And I think we have some objectives of this presentation and our session. And what we really want to do is we want to examine best and leading and promising emerging practices for engaging men and boys in health and development areas. We want to talk through some of the opportunities and challenges in engaging men and boys across life stages and diverse country contexts, as well as explore some of the programmatic implications for designing and implementing interventions using a life course lens. And so, as I mentioned before, we will go through a series of presentations. I'll talk for a few minutes, give a little bit of update on some of the thoughts that I've been having around this field recently, kind of talk a little bit about the do's and don'ts, one of the documents that we use a lot to kind of guide the work that we've been implementing around male engagement. Then Jeff will talk about life course theory and provide a little bit of an overview of that theory. Then we'll move to Rachita, who will talk a little bit more about an intervention in Zambia. And then hopefully Faisal will be able to join us this morning and we can jump to his presentation from Bangladesh on a television program that they've been implementing around COVID-19. My name is Dominic Shattuck. I'm the Director for Monitoring, Evaluation, and Learning for Breakthrough Action at Johns Hopkins Center for Communication Programs. I've been doing a bit of work in this field for a little while now, and I'm also a co-chair of the Male Engagement Task Force, which kind of puts me in this moment in kind of leading this webinar this morning. So I'm going to start this off a little bit differently than usual, and kind of I'm someone who's very influenced I'm a community psychologist, and I'm very influenced by my environment. And one of the things I've been reading recently is a book called Gynecology by Renee Almeling, who describes the medical history of men's reproductive health And so this story is one of stops and starts and trickling continuation, I think is one way to put it. She describes physicians and medical experts in the 1890s who attempted to start the field of andrology, a field that they hoped would parallel gynecology and provide a distinct medical specialization focused on men as reproductive beings. As Ameling describes the failure to establish this specialization, this pushed men to phony doctors, or what in the US we call quacks, very often to treat STIs and gonorrhea, STIs like gonorrhea and chlamydia, and often with insufficient services. And then she kind of fast forwards to the 1970s in the United States, and the idea of andrology actually didn't die. Emil Steinberger, the first president of a somewhat newly formed American Society for Andrology, said this about medicine and men's reproductive health. And he said, there's no single specialty that provides comprehensive care for the male patient with a reproductive system disorder. You know, you go to a urologist or you go to endocrinologist, you go to different people to get your services, but a woman would then go to a gynecologist, but there's nothing parallel. And I think we're still managing that now. And despite this kind of gap in services created, it creates confusion for patients and physicians. And amazingly, I think a lot of the work that we've done in male engagement is trying to fill this gap. And we've been trying to fill this gap a little bit and trying programming and engaging men in different ways around their reproductive health or their health in general. So since we're making up for lost time, I wanted to take a moment to reflect on where we are right now. And this is just some topics. This is not exhaustive by any means. In the last 10 years, there have been some seminal research projects on systematic reviews of male engagement program and systematic reviews of male engagement programming. There's strong evidence for engaging men across a variety of health topics. Global organizations, professional associations, and governments have developed guidance around engaging men. And new advances in male contraception are being tested, and the Male Contraceptive Initiative is providing serious leadership on this front. And you kind of can't talk about where we are right now without talking about COVID-19, which put men in the forefront in a lot of different ways. So first, research continues to show the elevated rates of infection and mortality among men of COVID-19. And it also revealed the reality of domestic violence, as rates of domestic violence skyrocketed under quarantine. COVID-19 also brought care and gender roles into the conversation at a time when it was relevant for everyone involved. And it also sparked some coalescing of practitioners through things like the Gender and COVID-19 Working Group that was led by Rosemary Morgan, very vibrant, interactive working group and listserv. So these are only some of the examples that are top of the mind for me. And we do have a chat feature, and I really hope that people will engage that chat feature and utilize it. And I'm going to challenge you a little bit this morning. So if there are topics that you feel have been relevant over the last couple of years around male engagement that I didn't mention today, that you feel should be recognized, or that people can kind of investigate more later on, you know, because I feel like the people who show up at this event are of the same, you know, have some experience in this field and that type of thing. And it's important to, and that's one way we can engage with each other before we get to the question and answer at the end. So if you have any suggested male engagement websites, project names, or champions that you want to call out right now in the chat feature, please do that, and it'll help everybody to follow up with them later on. So there are two areas of growth that I personally prioritize for the field of male engagement. I took this picture in a Nepali town on the border of India. And while there, I had a chance to speak with 4 young men between the age of 13 and 15. Through my Nepali colleague, we asked these kids about reproductive health, and I asked where they get their information about family planning. And their answer was, we learn about sex from Google. You know, of course they learn about sex from Google. Honestly, I wonder why I even asked the question to some extent. But in Nepal, 95% of the people live within reach of a cell tower, and kids have cell phones. And if they don't have a cell phone right now, they will have a cell phone very soon. So what we do have is we have a lot of programs that use cell phones and social media in powerful and innovative ways. And one of the things that I want to emphasize in my work and in the work of my colleagues is that when we're using social media, we need to ask whether the programs we're using or the programs we're implementing are maximizing the potential impact of social media. Are we using social media standards? Are we using methods and processes by which to maximize the reach and the impact and the messaging around male engagement and men's health, as well as gender equity? Planning out those interventions for tomorrow, we need to figure out some guidelines around this area that will maximize online reach and impact of social media platforms and to move this field forward. Secondly, something that I've been thinking about quite a bit in the last couple of years is how men are recruited into male engagement programs. Men are often linked to those programs through one of a few different ways. They're linked through a community-based organization who goes out and finds them, or maybe they've been working with through a different program. They're linked because they're members of a religious community or those very few workplace interventions that we talk about now and again. And the other way, and most often way in which they're linked to male engagement programs, is their wife, who will either talk to them or bring them into the medical facility through antenatal care or some sort of other services that are related to the services that the women are receiving at the medical facility. And until now, those channels for recruitment have been fine. The field of male engagement's built and tested and refined interventions, and sometimes we attempt to take the intervention to scale. Finding ways to increase the diversity among program and study participants is an essential next step. This will, increasing the overall beneficiary pool is important for reaching every man and every boy, and also impacting the lives of women, particularly those women who are in relationships with men who have less equitable gender norms. So I think the two interventions we will hear about today will provide a little bit of kind of out of the box reaching men across the entire community. And this kind of gets to the role and how we kind of conceptualize men in our different programs. And many of you are familiar with this pie chart, where we think about men as clients, as partners, and also as agents of change. And so I think this is a good framework for the work we've been doing and as we continue to do work in the future. And how do we get more men into this pie? How do we incorporate more men into the work that we're doing? You know, underneath the presentations today is going back to this guidance document, the do's and don'ts document. It provides a quick and fundamental guidance for developing and adapting interventions that engage men. It was developed through USAID-sponsored Male Engagement Task Force and vetted by experts and disseminated globally. Right now, it's available in 4 languages, and you have the website here, but I'll also drop it into the chat in a little bit so people can link out to it. Today, our presentations will hit upon several of the recommendations from this document, and I wanted to highlight just a couple of those. The first one is, don't overlook diversity of men and boys in the population. And I think that kind of goes with what I was saying before, in that there are a lot of different men. Men have different priorities, different needs, and different ways to engage with your program or your intervention. And integrating more of them into your program may be very helpful for everyone, including their wives and their family back at home. Do start early in the life course. You know, we've been trying to, our field and other fields have been trying to increase engagement around gender equity at younger and younger ages to not only to develop men into more equitable partners when they're older, but also to engage young boys around gender equity so that they have a better understanding of both health and the girls that they're sitting next to in class. And have better relationships in those settings. We don't want to engage men at the expense of women, and this comes up a lot in conversation. And the reality that it's not a zero-sum game, but also that we need to make sure that when we are engaging men, we're not reducing the access that women have to services, or we're also establishing linkages for women to get whatever service they need related to that intervention that's being implemented. And we do want to seek to transform harmful gender relations and norms. And this comes out a lot, the gender transformative work that was identified earlier on by Pramundo and other researchers is really critical to kind of conceptualizing the journey that men go through in these different interventions. And also, and I think this is kind of most important because oftentimes men have been depicted as the barrier, as they are in the Ameling book, Gynecology. We don't want to view men with the assumption that all men are bad actors. And so, coming to this where we address the community as they come. In some situations, you're managing some challenges, but we don't want to start from there. So thanks for listening, and I'm going to introduce Jeff right now. I don't think we have Faisal at this point.
Dominic, I think he's actually in.
Is he in
now? But
I'm in.
All right.
Thank you.
Great.
Sorry, I was struggling to have the access.
No worries. We're just happy to have you here today. So our speakers, myself, Faisal, Rachida, and Jeff. And our first speaker today is Faisal Mahmood. He's the Deputy Chief of Party, Social Behavior Change and Communication Advisor at Johns Hopkins Center for Communication Programs in Bangladesh. He has more than 24 years of experience with program management, resource development, branding, and marketing for integrated development and social behavior change and communication programs with diverse organizations, including Johns Hopkins, CCP, the BBC Media Action, Norwegian Church Aid, Canadian International Development Agency, Concern Worldwide, Save the Children, CARE, Handicap. You've hit them all, Faisal, I think. All the different NGOs. Through senior strategic positions in multicultural settings, he's developed knowledge and acquired expertise in program management, project development, and capacity strengthening for SBCC. He also has demonstrated ability to build and maintain strong linkage partnerships with governments and international organizations, as well as national and local NGOs. And he's going to talk about a really innovative and dynamic project that addresses COVID-19 in Bangladesh. And so on that, I'm going to hand it over to you, Faisal. When you're ready to advance to the next slide, just let me know and I'll click through.
Sure. Thank you. And thanks to Dominic for helping me out. So my name is Faisal. I'm working with Johns Hopkins in Dhaka, Bangladesh. And the presentation I will be sharing, it's a like joint work with risk communication and community engagement. Most of the countries who work on COVID, they should have some experiences of working with RCCE. This is a forum and platform where government and national, international NGOs work together. So in Bangladesh, next slide, please. In Bangladesh, I would like to give a structure of the age group of the population. You will see that in between the age bracket 15 to 64, like other countries, we have the highest population. And it's the data from DHS 2014. Next, please. This is our like population structure and population pyramid. The important thing here I would like to share that, okay, the young generation, they have quite a big chunk in the pyramid, and they are also sharing a lot of experiences throughout in the older age and the with the children in the school goings and others. So Dominic, please. We are going to, in the next slides, we are going to share about our content and messaging. I'm going to share in four main aspects. Number one, how we prioritize the messages and what we are going to do. Number two, how these were packaged, in different drama and other aspects. And number three, what were the behavioral considerations? And number four, I'm going to share the audiences and channels. So Dominic, please help. Yes. Uh, as I mentioned earlier, that okay, in Bangladesh we had really RCCE, like risk communication and community engagement. It is to give you a flavor. It is a network of around 70 NGOs, 4 government departments, and all other UN agencies who are engaged in the in different communication activities. They sit together, they identify the problems to avoid the duplication and others. So whatever messages were prioritized, it was developed and it was discussed in the RCCE meetings. Then what we did cluster the messages. And I'd like to mention again here that, okay, we, apart from the COVID process, we also thought about the gender issues and others and men engagement. So messages were clustered and messages were covered up with different aspects. So we worked on wearing masks, hand washing, social distancing, coughing etiquette, myth blasting, different, addressing the stigma and gender-based violence. So what we thought that, okay, we were really struggling. There are a lot of issues and what we are going to cover. Then we went to the media analysis, and we identified that in the television, we can go either for advertisement or for drama or for addressing through different other programs. So finally, we identified that, okay, most cost effective and the way to reach many people and reach mostly the men and the other, maybe drama is one of the option. I'll be sharing more on that. Let's go to next slide, please, Dominic. Okay, so what we thought that, okay, how we can package our public communication, and we identified that we had all these like 5 components. Number one is the drama series. We had 4 drama series. Each was 5 episodes in total. So 5 into 4 equal to 20 episodes of drama was developed within a very short span of time. We had our web portal, which contains different information regarding COVID, myth blasting, about the government rules and regulations, what to do. And also this web portal, the different organizations could use to minimize the duplications and maximize the utilization of the resources. So that was important. We went into the digital contents like Facebook, YouTube, other social medias. Point to mention here that in Bangladesh, Facebook and internet is synonymous. If you go to a village and ask a villager that, okay, do you use your internet? They will say that, yes, I have a Facebook account. So whenever we say about the social media, it's mostly Facebook. And we had radio programs with 1 FM radio, which covers all over the country, national level FM radio, and 16 community radios from different areas. So we had programs with 1 FM radio and 16 community radios. Interesting thing is that with national radio, we went with the sophisticated sort of and usual mechanisms and usual like languages. With the community radio station, we had both to see, like the sophisticated one and the local languages. So we have mixed, sometimes the sophisticated language does also work. Like when a doctor comes to give them some advice for like as an interview, they feel that, okay, sophisticated one is better. Then we had the community outreach. And through the community outreach, our most important aspect was how we can engage men. So this was also one of the aspects, because we went different bazaars, the community places where men hang around. So in these places, so men engagement were really one of our choice, and we wanted to ensure men engagement. Next slide, please. So as I mentioned earlier, when we selected the we will be going into the television, we had different choices, but we selected drama. So I would like to share here that drama, the reason behind it, drama is very popular in all the age groups in Bangladesh. Dramas can be accessible through both social media and through the television platforms. Next, please. This slide shows news, cinema, and then the drama. It's the most popular format. So that's why we did choose the drama serial as one of our programs. Next, please. Yeah. While developing the drama scripts, and while developing these issues, we had some of the behavioral considerations in our mind. Number one, we had a lot of discussion with the target audiences. It's not that, okay, scriptwriters said and they themselves developed. So we had our priority messages. We identified that one. But at the same time, we use people-centric design of our drama series. A discussion at every level, including men, women, and in some cases, adolescents were involved in the discussions. We had workshops with different stakeholders. And then not only with that, we had also workshop with TV stations. Most importantly, we had workshop with the drama directors, because they will be portraying the main behaviors and the relationship between the men and the women. So we had a lot of direction workshop with the directors. So there was a challenge, like all these drama, these were filmed during the COVID situation. So the safety, security, and all other aspects were also one of the issue. We had different meetings with the drama directors. And we identified throughout the process that male involvement is very crucial, and specifically addressing the issues of during the COVID-19 situation. So it will come into our next slides. So please, next slide. While we went into the behavioral considerations, we have seen that, okay, directors and writers, they thought that we should bring some of the characters, like doctor should be there, some other health workers should be there, teachers, local leaders, youth club leaders. At the same time, there were some issues like journalists and other issues should be there. We did bring these issues in our drama. Besides, we also had feedback from the target audiences. They wanted, the feedback from them is that they wanted the male members of the family should be regarded. At the same time, they thought that educated people should also be accepted during this process, and spousal communication was one of the important aspects. And throughout our drama, though we tried to ensure male engagement, the spousal communication was an integral part in the whole drama. So as Dominic was also mentioning, that male engagement not at the cost of not taking care of women. We were very careful into that. And we also identified that this is the social dimension as well. So Dominic, please. In our dramas, we had the primary audience adult females and males in rural context. Also, the secondary audiences include family members and social influencers. One target group we didn't mention here, but through the RCC, as I mentioned, that we were working with around 60 national, international NGOs and other stakeholders in different aspects. Some of the clips of the drama was also used for the social gatekeeper. So that was also one of the like tertiary target audience. Next, please. Uh, Interestingly, we had we choose four top running TV stations in Bangladesh, and these were Dipto TV and Channel I, the RTV, and Masranga. So these are the four TV channels we did choose, and one commitment we had from the TV stations that, okay, they will be putting all our drama series after the on air, they will be putting it into their social media pages. So this does not go away. This does not become one-off show. So these were put into the social media as well, and these are still accessible. And we observed that, okay, people are accessing a lot into that. So next slide. Like in Bangladeshi mobile internet user, because I mentioned that, okay, these drama, they are still live, though they had been on air by the television only once, but they are still on the YouTube and others. So people are accessing, and the overall around 80% of the people have the access to the mobile internet through different means. Next slide, please. Now I would go into a little more discussion about how we integrated like gender aspects and into our different pre-production process. So we actually used both gender sensitive and gender transformative approaches. So it was a blend. In some cases, it was the gender sensitive, and in some cases, it was the gender transformative approaches. Basic practices were also promoted throughout the process. So we had these two main considerations. In the pre-production stage, we identified key messages and prioritized and clustered the messages. Then, while developing the script, we developed the synopsis and character bios. At the same time, we went to the concept testing, and our like research team there, they helped us in the pre-testing of the scripts, and we got feedback from the like audiences, and their suggestions were incorporated. So we had a rigorous process. Then we had the review in our headquarters, and also reviewed by in-house gender specialist and others. So we went through a rigorous process to ensure that, okay, like not only the production people are involved, so different stakeholders are involved in the whole process to ensure gender sensitive and gender transformative approaches. Next slide, please. And now I am going to share a little bit about four drama series that we shared. The first series, its name was The Price of the Stupidity. It is a very interesting story. It shows the initial stage of the COVID intervention in Bangladesh. Three village young people, the young friends, they took COVID-19 as a like joke, and they used to make a lot of rumors, odd events. Like here, in the picture, you see that, okay, they are putting saline water into nose. Sometimes they are saying that, okay, if you take, like all the rumors that were spreading during that period, if you take this like vegetation, you will not get COVID, all other things. But at the same time, we had few male characters who were positive characters. So they were countering them. So it was a very interesting clash between these three paid stupid, but they were really the synchronization was really good. So at the same time, we also identified that male, they interact mostly on the private places, and some of the males, they bring out the rumors, and some did misspell these rumors, and they did share the correct messages. Besides, we had a focal male character who was promoting the healthy behaviors, and he was well respected in the community and others. So we will see a little bit of the drama. Next slide, please. So now we will see a short clip of our drama, please.
Dominique, I don't think the rest of us are getting the audio. You may have to do that during your share screen settings.
Yeah, audio is not coming. Sorry, there might have some problems with the audio, but
I can try to get to that point again.
Sure.
Yeah, it ended there.
Okay, maybe we have another clip. Maybe we will see that better. The next one was the frontliners. So this story did share the initial experiences of the frontliners that they faced during the first stages of the corona and the COVID period. The frontliners, they had to struggle in their workplaces. So we had police characters like police, nurse, doctor, and journalist. So their struggles, and at the same time, at the end, we saw that positive men are helping them out. So we had 4 drama series. This was the only drama series that was set in urban premises, and that amplifies the men playing important role and helping the female and other family members and colleagues.
আচ্ছা, আপনি ব্যাপারটা একটু বোঝার চেষ্টা করুন। আমাকে বোঝাতে আসছে? আচ্ছা, এই বাড়ির কারো যদি করোনা হয়, এই ড্রাইভার কে নিবে? কিন্তু চাচা, আমার স্ত্রী তো একজন নার্স। ও যদি হাসপাতালে না যায়, এই সময় মানুষ কিভাবে বাঁচবে? কিন্তু তিনি যদি করোনা নিয়ে এসে এই বাসায় ছড়ায়, তখন কি হবো? আচ্ছা, নাজিরা তো সব নিয়ম কানুন স্বাস্থ্যবিধি কঠোরভাবে মেনে কাজ করছে। সে একা এক ঘরে ঘুমায়, তার ছেলে পর্যন্ত তার সাথে থাকে না। খুব ভালো কথা, এটা আপনি যেখানে ইচ্ছা সেখানে গিয়ে করেন, আমার বাড়িতে না। আঙ্কেল, আমার মনে হয় সাজ্জাদ স্যার ঠিকই বলেছে। মানে শোনেন, এই সময় কাউকে না কাউকে তো এগিয়ে আসতেই হবে, সামনে থেকে লড়াই করতে হবে। না হলে যারা সংক্রমিত হচ্ছে তাদের চিকিৎসা দিবে কে, সেবা দিবে কে? আমরা নাজিরা আপার ইন্টারভিউ টিভিতে দেখেছি, উনি কত না কষ্ট করছে। নাজিরা আপা পেশাগত দায়িত্ব পালন করছে, নিজের জীবনে ঝুঁকি নিয়ে মানুষের সেবা করছে। এটা অনেক বড় স্যাক্রিফাইস আঙ্কেল। আমাদের উচিত নাজিরা আপার মতো মানুষদের উৎসাহ দেওয়া। এই মহামারীর সময় তারা আমাদের সামনে সারির যোদ্ধা। আমি আসলেই আপনাকে ভুল বুঝেছিলাম। সত্যি আপনারা বাইরে আছেন বলেই আমরা নিরাপদে ঘরে থাকার সাহস পাচ্ছি।
Okay, let me explain here a little bit about the previous drama. That it was the struggle of the four nurses. The clip we have seen here, the nurse used to stay in a house with the family members, and the like landlord, he wanted the nurse to leave the house, and finally, like the main members of the society, they came and motivated him that okay, it is because of her people are getting treatment and all other things. And finally all the men, they recognize the role of the nurse, and they welcomed her to go to her workplace. The third one was the unbeatable. Interestingly, this was a drama about a group of young people. They stay in a village, but they are proactive. At that stage, there were a lot of mismanagement in supply chain. Food and other commodities were not accessible. So they tried to make that accessible and make that available to the community levels. And at the same time, they also worked to make the situation better. At the same time, we have seen that okay, males, it is important that okay, we still in the society, males still are perceived as the leader of the society. Though we want balance, this is the reality in the society, especially in Bangladesh. And young men, and but we have seen in the drama and in the real scenario that okay, young men and young women, they can support each other. So that was also portrayed in the drama. So next one. This was this name was the thread of hope, and we did try to together that okay, different strata of the people, like there were some different homemaids, there were teachers. So we saw the struggle of different level of and different strata of the people. And in the drama, it shows that okay, no one is isolated. Like everyone is tied with an unseen thread. If my at my home, I feel that okay, I am safe, but the drivers and others, we all are interconnected. So through an unseen thread, but we also saw that young students, they are helping the community in this drama. And we had a very strong male character here, the teacher, who helped the young men and also the community people, not only fighting the COVID, but also preventing early marriage, gender-based violence, all these things during the COVID period. So it is well known to others that okay, these issues were pertinent during the COVID period. So this teacher, he played a very important role. Next. So the practical approaches, I see in the that there are some of the questions, I think it will answer. So practical approaches that we took is the positive role models. teachers, leaders, and relatives and frontliners, they can be positive role models. Young people are very proactive, and they can play a role in gender equality and preventing gender-based violences. We also promoted the government helplines strategically, because at that period, there were a lot of rumors, misconceptions, a lot of other things. And interestingly, the private sector involvement was promoted. I would like to say here that you all know that airing the drama or airing whatever the product through the television is very, very expensive. But in our cases, all this drama were shown by the TV station at free of cost. We didn't pay any airtime, not a single thing for this. So private sector involvement was also promoted to a greater extent. Overall, for each drama on the television, it was around approximately 10 million views for each of the drama serials. And as I mentioned that, these were also promoted in the social medias. Next slide, please. Next slide. Yeah. This is in the digital platform. This is still going on. I would like to share some of the comments in the digital platform that, well-written drama on the current issues, we need respected frontliners to save because they save us, like the drama, all other things. So these were the some of the positive feedback from the users. There were a few suggestions that we could bring children into this and others. So there were some suggestions as well, which we are considering in our next productions when we are going. But we had also limitation of the resources. We only did each of the drama only 5 episodes. So that was also considered. As I mentioned, it was free. It was on-air free at the through the TV station, and they are also keeping this in their digital media and social media. And all the NGOs, they are utilizing this in the community mobilization activities and others. Next, please. Lesson learned. I think I would echo with Dominic. He was these were also one of the also similar findings. Number one is gender balance in characters is very much needed with a broader audience. This is really, really important. You cannot really put emphasis on a specific gender, gender role was one of the important aspects, and adaptation on the gender role were one of the important lesson learned from our end. As Dominic was also mentioning, include men, but not on the expenses of women. During this process, we have learned this, and this is a very significant learning. We are incorporating it in our different future programs, crafting of messages is really important, that no gender is offended. So these are the 4 important lesson learned from our end. We are incorporating it, and while other people are incorporating these programs, so these also can be important tool. So I think I'm done.
Yeah.
Thank you.
Thank you so much, Faisal. This is great. The videos are really helpful to kind of provide a bit more context of the interaction and how people were kind of engaging on the videos themselves. And this is great. And we have links here, and we can provide additional links to some of these resources as necessary, or you can reach out to any of us on the panel. I'm going to move quickly to our next speaker, who is Ruchita Pillai, who works with me at Johns Hopkins Center for Communication Programming as a monitoring and evaluation advisor within the Breakthrough Action Project. Ruchita supports social and behavior change global health projects through research, monitoring, and evaluation activities at the Center for Communication Programs. She has experience working in sub-Saharan Africa and Asia in the areas of sexual and reproductive health, HIV, family planning, malaria, maternal, newborn, and child health and nutrition. She earned her MHS in social factors in health from the Bloomberg School of Public Health at Johns Hopkins. And I'm really excited to invite her to speak and talk about her project in Zambia. Ruchita.
Thank you, Dominique, for the intro. I'm going to pause my video just to preserve my internet. Hello, everyone. Thank you for joining. Let's jump right into it. I'll be presenting a case study from our Breakthrough Action Zambia project. I'll aim to highlight how the project focused on reducing stigma and improving access with integrated health wellness days for adolescents and men in Zambia. Next slide, please. The Breakthrough Action Zambia project was a 3-year integrated health, social, and behavior change project that included a national mass media campaign, along with community as well as clinic-based interventions. The project focused on 6 priority health behaviors, namely family planning use among adolescents, HIV testing access, condom use, optimal complementary feeding for children under 2 years, timely care seeking for children under 5, and insecticide-treated net use for malaria prevention. The focal audiences for the project included adolescents 15 to 19, men 20 to 55, women 20 to 49 years, including mothers of children under 5 and mothers of adolescents. And of course, healthcare providers, including community health assistants and volunteers. For the purpose of this presentation, we'll be focusing on adolescent boys and men. Next slide, please. The Global Breakthrough Action Project developed an SBC flowchart to inform program design, implementation, and evaluation, and it included 3 phases. The Breakthrough Action Zambia project was one of the first countries to apply this flowchart. Next slide. In phase 1, we employed various methodologies, including human-centered design, social and behavioral science, qualitative research, as well as literature reviews to gather the evidence and the Zambian context around the priority health areas. Next slide. The evidence gathered was organized within the socio-ecological model to understand the lived experiences of our audiences and the country context. Next. Looking at adolescent boys, there was this overall perception that health facilities are for women and children. In terms of our family planning for adolescents priority health area, we saw that they started young, 11% reporting first sex at age 15, and the number going up to 32% by age 18. We also noted that more than half of the premarital fertility in Zambia came from adolescents giving birth. Next. At the interpersonal level, male partners tended to be thought of as the final decision makers on condom use, but on the other hand, female partners were seen as the ones responsible for unwanted pregnancy. Next. At the community level, HIV testing and family planning access for adolescents was seen as promoting promiscuity or transactional sex, or even sex with married partners. In addition, child early and forced marriage remained common in Zambia. Next. At the structural and enabling environment level, adolescents reported a lack of access to sexual and reproductive health information, resources, as well as services. Sex education seemed to perpetuate harmful gender dynamics, such as girls should behave, don't trust boys, abstinence is the only protection, dress modestly, while on the other hand, promoting boys to use condoms. Next. HIV and family planning services for adolescents was found to be highly stigmatized, even at the clinic level, especially when unmarried. And adolescents reported privacy and confidentiality concerns, as well as experiencing negative interactions with providers that kept them from seeking services. Next slide. For men 20 to 55 years, next, we saw some overlap in the evidence with adolescent boys, such as the perception that health facilities are for women and children. This tied into sort of this overarching notion of illness, weakness, and masculinity, but also in general who they were used to seeing at the facilities themselves. Next. Other commonalities included concerns over privacy and confidentiality, negative provider attitudes, and being stigmatized for seeking HIV and family planning services at the clinics. In addition, men reported low care seeking for HIV testing, as well as low condom use at last sex, even with multiple partners. Next. Men also reported fear of disclosure of testing positive for HIV, and that leading to stigma and isolation. Men reported not discussing health or health-related topics among their peers and highlighted the lack of forums fostering such interactions. Next. And even for adult men, accessing HIV testing and family planning services was stigmatized and seen as signs of engagement in transactional sex, extramarital affair, or sign of infidelity. Next slide. In phase 2 of applying the flow chart, out of the research findings and insights, the Breakthrough Action Project designed 8 prototypes that were then user tested for potential interventions. Out of those 8, 4 prototypes were finalized, and the monitoring and evaluation plan for tracking those interventions was developed. Next slide. The finalized innovations implemented for adolescents and men included integrated health wellness days. These were supported by a clinic-level confidentiality pledge for providers to improve the provider-client interaction. Next. And all of these were supported by an overarching national umbrella campaign known as the Family Health Campaign, with the slogan, "Life is precious, take care of it." Next slide. Each of these wellness days were a monthly dedicated day where these groups could seek counseling and services on sexual and reproductive health, family planning, HIV, nutrition, malaria prevention, as well as general wellness. General wellness included, for example, services like blood pressure and sugar checks for adult men. Men who were fathers of children under 5 also received counseling on how they can support their children's nutrition and wellness. During the private consultation, adolescents and men had the opportunity to ask any health or wellness questions they might have. In the case of adolescents, while they were waiting for their private consultations, they also had the opportunity to participate in informative group games and activities that were facilitated by peer educators and community-based volunteers. Next slide. Apart from our local partners and the Ministry of Health in Zambia, the Wellness Day garnered support from village chiefs, community elders, and other community support structures, making Wellness Days for adolescents and men major community events. Just to highlight key quotes, a health provider on Wellness Day noted, "It was exciting. The adolescents could open up to me and tell me what they were thinking and what they want, like family planning. I wasn't expecting that because most of the time the adolescents in the village are shy. When they come to the health center, when they're sick, they're not free." After attending several men's wellness days, the director of the health promotion department in Zambia noted, "We've been trying in Maine for so long to attract male clients to health facilities. What have you done to bring these many men to the clinic today?" Next slide. Now, I won't have time to actually highlight all of the other SBC innovations from the project, but here are a few materials that we used during the wellness days. Other SBC materials included, but were not limited to, a comic book series for adolescents discussing health issues, radio spots, community events, even soccer tournaments, and also social media groups for our key audiences. I'll be happy to share the details of our center's repository where many of these materials and materials of the other projects live. Next slide. So what happened? The project conducted 130 rounds of adolescent wellness days between April 2019 and March 2020. So that's just about a year in the 4 implementing provinces of Zambia. About 12,600 adolescents in total attended, of which 6,500 were male adolescents and 6,000 were females. On average, 96 adolescents attended a single wellness day. Out of the total adolescents reached through wellness days, 4,000 received HIV testing and counseling services, and among those, 37 new positive cases were detected. 5,000 were screened for malaria, with 800 reactive cases detected. And 5,000 family planning counseling sessions were conducted, during which 560 adolescents became new users of a modern family planning method. Condoms were distributed with every health information packet provided to adolescents and men. Next slide. Men's wellness days also attracted a large number of clients, with an average of 76 men attending each wellness day. The project conducted 136 rounds of men's wellness days, reaching 10,400 men. Of those reached, 4,400 men were tested for HIV, with 105 new positive cases detected. 5,200 were screened for malaria, of which 800 malaria cases were detected, and 5,100 men were counseled on various methods of family planning. Next slide. In phase 3, after a 6-month implementation period, the project conducted a mini survey. The findings from the routine monitoring data, as well as the mini survey, were used for the scale-up plans and the adaptive management of the project. Next slide. So what were some of the key outcomes? The monitoring data for adolescent wellness days highlighted increased openness and confidence by youth to demand health services, improved youth-friendly services, and improved treatment of youth clients by health facility staff. Providers and adolescents were now addressing sensitive topics and asking questions that are traditionally considered taboo, including consent and sexual assault. Adolescents coming to the wellness days were more knowledgeable and proactive about their health and healthcare needs and what they wanted to get out of their visit. And there was an increased patient and health facility staff satisfaction with these integrated services, affording adolescents a one-stop shop and access to a diverse group of health as well as non-health professionals. Next slide. For men's wellness days, the exclusive men-only nature of the wellness days attracted men to visit the facility even if they were not sick. Some men attributed their willingness to attend to the commitment made by providers to uphold privacy and confidentiality during the events. Men were encouraged to attend the wellness days for their own health as well as the health of their families. In certain instances, men requested additional services not offered during the wellness days and required referrals, such as dentist appointments and appointments with eye specialists. Even services that are sometimes stigmatized or misunderstood were requested during wellness days, such as circumcision. Message diffusion led to more and better prepared clients requesting services during these events. Next slide. Now, just to highlight some of the findings from the mini survey, this is specifically around some outcomes related to program exposure effect of the Breakthrough Action Project. Looking at the percentage of male respondents, we looked at program exposure effect going from no recall or logo only recall to project media only exposure to then face-to-face only exposure, which included community events such as wellness days, and then finally the composite program exposure of media and face-to-face activity. Next. So for percentage of male respondents using a contraceptive method or their partner using method at the time of the survey, again, this is only after a 6-month implementation period, we saw that male respondents with media only and media plus face-to-face program related exposure were more likely to be using a method compared to the other groups. Next. For future intention to use a contraceptive method, Male respondents with media only, face-to-face only, as well as the composite media and face-to-face exposure were all more likely to report future method use intention than the no recall group. Next. We looked at support for adolescents' access to contraception across our various audiences. Male respondents with any kind of program-related exposure were more likely than the no recall group to support unmarried adolescent boys accessing condoms. Next. Male respondent support for unmarried adolescent girls accessing contraception was noted to be lower compared to their support for boys' access to condoms. Male respondents supporting girls' access to contraception was found to be more likely with any breakthrough action related program exposure compared to the no recall group. Next. And lastly, looking at health facility visits, and this is for all respondents, male and female, we saw a slight increased likelihood of respondents visiting a health facility with program-related exposure compared to those with no recall or exposure. Next slide. Unfortunately, COVID-19 hit right at the end of the Breakthrough Action Zambia project, and we were not able to do further surveys and data collection, and in fact, we're not able to hold events like wellness days. Despite this, the monitoring data and the preliminary results from the mini survey, we saw indications of the project's positive results. So why did it work? The project reframed health facility visits as wellness checkups, focusing on preventative care rather than solely for treatment of illness. Embedding family planning and HIV into integrated health programming with the hope of removing stigma and sensitivity around information and care-seeking behaviors right at the health facility level. The project recognized the differing health needs at critical junctures in the life course of boys and men, recognizing the beginning of adolescence and sexual activity, the shifting roles with some starting parenthood as early as their adolescence and taking on the provider roles for their families. Reframing the provider role in the family setting to include health for boys and men themselves, as well as their role as partners and influencers of the health of their families. The project ultimately created an enabling environment men and boys needed to seek care through the implementation of the wellness days as well as the larger family health campaign. Focusing on health facilities and providers, addressing men and boys' concerns and distinct needs around privacy and confidentiality, addressing the structural and socionormative barriers that kept men and boys from visiting health facilities, and also positively framing health behaviors, including family planning and HIV, as a way of taking care of their life and the life of their family members. Men and boys were no longer seeking care alone, but standing alongside their peers and neighbors for services that were specifically designed for them. Along with being an integrated social and behavior change project, utilizing various evidence-forming methodologies, the Breakthrough Action Project took an integrated health approach to its 6 health areas rather than a siloed one. If we see men and boys at the center as priority groups, the project used evidence-based programming to apply the socio-ecological model in their goals of addressing barriers, improving access, and increasing engagement of men and boys in their own health and that of their families. And in doing so, without knowing at the time, the project checked several of the do's and don'ts for engagement that Dominique highlighted for us earlier on. And with that, that is all from me. Thank you.
Thank you so much, Ruchita. I really, that project is a real highlight for me in terms of, you know, when you build it, they will come in a way, in terms of the men showing up, the thousands of men showing up for a limited number of days to get access to health services. And then also the wide range of services that the men received, you know, is really important to recognize in this project, and understand that there are a variety of needs that men are going without in certain contexts. and how to create opportunities for them to access those services. And I think, you know, part of accessing services is timing, right? So and when we talk about timing of is it sparked because of a campaign like the campaign that was implemented in Zambia, or are there, when we think about those campaigns, are there also critical moments in individuals' lives that will help us to kind of push the campaign out, or to develop campaigns that are kind of engaging people in different transitions? And I think that's a big component of what Jeff Edmeades is going to talk about today. And Jeff, those of you who've gone around the male engagement circuit may know him well, and he has done a lot of work around the life course theory, and is going to share with us a little bit of that today. But before that, I'll give you a little bit of background for those of you who are not familiar with Jeff. He is a social demographer with over 20 years of experience researching and programming, addressing gender, sexual and reproductive health rights, and reproductive empowerment. In 2018, he founded Demographics, an independent consulting firm, after working at the International Center for Research on Women, ICRW, for 12 years. He earned his PhD in sociology, specializing in demography from the University of North Carolina. And I'll hand it over to Jeff so he can get us moving into the life course theory, and provide a little bit more kind of framing and understanding as to, you know, what this theory kind of provides in terms of intervention timing moving forward. Jeff.
Thanks, Dominic. Yes, as you said, I think this is a bit more of a theoretical perspective on understanding really what life course theory is and what it means for our programming. We often talk about life course without necessarily really truly thinking about what the theory is. So there is actually a life course theory. A lot of it feels very logical, very common sense, but it exists out there, and there's a whole stream of theoretical literature around this that I think is important to acknowledge. So today I'll be really talking about applying that life course perspective to understanding men's needs and vulnerabilities at different points in the life course, and what that means for thinking about how and when to work with men and boys. So I'm building mostly on two pieces of work that I've done recently, one with the IRH, Georgetown Institute for Reproductive Health, Passages project that's funded by USAID, mostly working most closely with Natasha Stevanovic-Fenn there. And then another piece of work with the Demographic and Health Surveys project, also USAID funded, with Carrie McQuarrie and Julia Florette. And I'm just posting those in the chat box now, links to those reports. Next slide, please, Dominic. So why a life course approach? So what does it offer that we don't already have? Well, we know that programming with males has often been fragmented, looking at single points in life, at just single needs, rather than thinking of a more holistic type approach. But we know also at the same time that vulnerability and needs are not static, they're cumulative, they're shaped by both individual and environmental factors. And life course theory really provides a conceptual framework for understanding all of this together, why people behave in particular ways, how this changes over time, and what the influence of context is on behavior. So it puts all of those things together into one neat package for thinking about understanding behavior. So really, it's more about a more holistic approach to thinking about programming in men's lives, or people's lives in general, and links well to programming decisions that we have to make. So how would we define life course theory? Next slide, please. So it's not the same as lifespan, life history, or life cycle. Those all have very specific meanings. We tend to mix them up, but they're not the same. Life course theory is thinking of life as a series of age-related patterns of behavior that are embedded in social institutions, so don't exist alone, but they're also reflective of personal experience and social history. So really, it's a record of age-related transitions that are socially created, socially recognized, and socially shared. That the emphasis is on socially there. I'll explain more of what all these different pieces mean, but I wanted to give you a good definition of that now. Next slide, please, Dominic. So if we think of life course theory, it really is based around 5 core principles. The first is human development and change are lifelong processes. So we're always evolving, we're always learning, we're always adapting to the circumstances that we have. So it assumes that there's a process of human development going on, as well as biological change, obviously. The second principle really builds on the idea that individuals have a role in determining the direction that their lives take. So very often large sociological type theories lean heavily on the idea of the sort of influence of society on individual behavior, but it is important to also recognize that the decisions that we make construct our own life course, and the actions that we take build and direct the direction we head in. So choices that we make are important, and they're based on what we see as viable alternatives at any point in time. The third principle is really around the idea that individuals, while we shape our own life course trajectories, are also influenced very much by the context that we live in. So that can be the historical economic environment, it can be where we live, rural versus urban, what countries we live in, what areas of the world we live in. All those matter for what we can do, what our life courses sort of can look like in the long term. So next slide, please. The fourth key principle is that the effect of specific events that shape behavior depend on when they happen in people's life course. And we'll come back to this one in particular because it really matters a lot. But really the significance of an event, if we think of say, childbirth, the birth of your first child, as a demographer, something I'm very interested in, that the significance of that really depends quite a bit on when it happens in your life course. If you're having a birth very early, as socially defined when in adolescence, that can mean quite a different thing as to later in life when you're perhaps in a different life course where it's more socially expected. So the idea here is that there are these events that can take place, and they mean quite different things depending on where you are in your life course. And these are tied to the social expectations, social ideas of what is an early versus a late versus an on-time event. And we'll talk more again about that in a second. And lastly, with this principle that's really important, is that events that happen early in the life course can have lifelong and cumulative effects. So what we might see as a decision that someone makes when they're 13, 14, 15, or something that happens in their life, an economic catastrophe, war, displacement, so on, that can have effects that matter, that echo throughout the rest of their lives in one way or the other. The fifth principle is really that people's lives are lived interdependently. So what happens in the life of one person matters for outcomes in the life of another. If a mother or father loses a job, that matters for their children. It might also matter for their parents. So we don't live alone as we're learning. And of course, many of these things may seem quite obvious, but bringing those together into one coherent approach is what I think life course theory offers, and what can be quite helpful in terms of just envisioning programmatic changes. Next slide, please. So if we think of the key concepts here that we've discussed, I think there are three that I want to focus on in particular. First is life course stages. So the idea that there are stages that we live in throughout the life course that are sequentially ordered according to some social definition of what they are. They're loosely tied to age. So if you think of what childhood is, these things exist in most societies, ideas of certain life course stages. Childhood, some transition point to adulthood. Adulthood, it can be broken up in pieces, as we'll see. But they're socially defined, but linked to age. So as you can see, when we think globally, there's quite a bit of variation around how people think of youth or adolescence. And so it's not, of course, tied somewhat to age, but when we're talking about youth as ending at age 30 in some places, but age 25 in others, or adolescence as being a longer period, a shorter period, that is a reflection of the social definition of what that life course stage is like. So the transitions are the points between life course stages where you're moving from one to the other. They can be a single event, but more often they're a collection of events that mark a change in status. So when you're moving from being an adolescent to being an adult, that might mean moving into your own home, starting your own family, becoming economically independent, or other things like that. It depends that, again, that transition is socially defined in terms of what it requires. Then there are turning points, which are particularly significant events that send your life course on a different direction. So that could be something dramatic, like, as we were talking about, a loss of a job, requirement to move, being displaced, or it could be an opportunity, a scholarship, someone paying for you to go to school that sends you in a very different direction. Next slide, please. So if we think of the collection of life course stages as a trajectory, it's your pathway that you head on, that people typically pass through these life course stages in a certain order. And most societies have these, as I mentioned before, with childhood, adolescence, adulthood, and so on, is kind of ordered in a certain way. Individuals are working out their own individual life courses, but usually those are within a broad set of boundaries of what's socially acceptable in a given place. So most people, even though there's variation in how they go about these things, tend to pass through the same broad trajectories, what we would call a social pathway in a given context. And obviously the edges of those pathways are socially defined by where social institutions and cultures that people live in. Next slide, please. And I do apologize, I'm not covering every point in these slides, but it's a lot to cover in a short period of time. And I hope these slides can be more of a reference point going forward. So if we think of time, what does time mean in the life course framework? It's really thinking about how we as individuals are moving through time as we live our lives. We're moving through a biographical time, the story of our own lives, but we're also moving through history. And if you think of right now, we're living in a truly historical moment. We're living in a point that will be remembered for and mentioned in history books for a very long time, with COVID and all sorts of other transitions happening right now. So we're living through this event. It's affecting our lives, the shape of our lives, and everything else. So age in this context is really viewed as a social construction. So there is biological aging that's going on that is attached to certain biological features, such as puberty and entering adulthood and other things like that. But really, age is used as a marker for you moving through life course stages in the right order and at the right time. So it's what we think of as a social timetable. So this timetable specifies appropriate ages for these transitions and for the sequencing of life course events. So transitions can be, in this context, early or late, or on time. And the issue here, the example I gave before of very early childbearing or fathering a child in the case of men, that the idea of what is early is a socially described feature. So it happened before it was supposed to on this social timetable for wherever the person is living. And obviously that timetable can be much earlier or much later, depending where you are. If you're living in Germany, the expectations for when you have your children are quite different than if you're living in Mexico or in South Africa or in Ethiopia. All of the timetables are different because the timetables are socially constructed. So if we think of very quickly, next slide, please, of how we might visualize the life course. Here is just a visualization of how we might move through different stages. And so you can see on the very left, beginning with infancy and childhood, then there's early adolescence, later adolescence, early adulthood, a middle adulthood, and a later adulthood. Now, these are, as you can see, tied in some ways to age and to biological development, but the expectations for behavior and for what you should be doing at different points in time really help define what a life course stage is. So we'll talk a bit more specifically to give some examples of that in a couple slides. So next slide, please, Dominic. So what I've described so far applies to everybody. It doesn't just apply to men or women. But what is the linkages, and how is masculinity in particular tied to the male life course? What are the things that distinguish the male life course from the female life course? So we know that social norms themselves are gendered. There are different expectations for men and for women. And we know that gender as a whole is a key organizing factor for society. So it makes sense that the norms of masculinity, which are tied very specifically to definitions of manhood in society, what is it to be male, provide the rules that define what behavior society views as appropriate in a given life course stage. And those are very closely tied to what it represents to be an ideal or real man. So those are quite common across cultures. Typically, men are expected to be the financial provider, a protector, a family leader, a husband, a father. Those are common expectations across many different societies and cultures, along with this idea of assertiveness, physical dominance, heterosexual prowess, emotional toughness. Those are expectations that are part of how we define manhood in many places. So the degree to which men are able to exhibit certain traits and perform certain roles, those expected roles for different life course stages, are really key to understanding what their needs and vulnerabilities are at a given point in their life course. So then if we think about, there are particular challenges that men face as they're trying to transition to certain stages or as they are transitioning. And those are both difficult points of difficulty, but also opportunities for reinvention. And from a programmatic perspective, a really great time to intervene. Next slide, please. So if we think of what these are, so what are the norms of behavior, expectations of behavior at different life courses? And here, life course stages, I'm going to focus on 3 right now: later adolescence, early adulthood, and middle adulthood, because that's often where a lot of our programming is happening at the moment. You think of later adolescence as a period when a lot of the male norms, the norms of masculinities are really becoming more entrenched. There's expectations of heterosexual relationship formation. There's expectations often of sexual activity, risk-taking, but there aren't expectations yet of real long-term relationship formation. It's often the very first experiences with relationships and relationship dynamics, but this is a transitional life course stage in many ways. Next slide, please. As people move into early adulthood, the social expectations shift. So we do have, there's some shift in age, but really what's changing is what people expect the person to be doing. Typically, we're looking at finalizing their education, gaining full-time employment, leaving home, entering into more stable relationships, and potentially the beginning of childbearing. And if young men are unable to transition, to make that leap from adolescence into adulthood because they're, let's say, financially unable to do things like leaving home, or the economy doesn't allow them to get jobs, they could be stuck in this limbo of in-between stages. And that creates this massive issues of stress around being unable to perform socially expected roles when you're supposed to. And I think many of us have probably experienced in our own lives pressure, either really overt or benign, to marry at a certain time or have children at a certain time, or it's too late, you're going to school for too long, all these questions. Those are markers that we are somehow getting off the social timetable. And being off time, either early or late, comes with a social cost. It comes with the perceptions that you're somehow deviating from what you should be doing. So as we're starting to move into early adulthood, this is where young men really face for the first time the real pressures of being the financial provider, being that protector, and a lot more social obligations that are assumed to come with this adult status. Next slide, please. So middle adulthood is really where we spend most of our time in our most life stage and life courses. We spend a lot of time here thinking about consolidation of gains made in early adulthood. There's a need to transition of roles becoming much more stable in terms of being a provider. Leadership in the family and community are often expected. This establishment of a career, more stable income source, where in early adulthood, the gig economy or other types of less stable employment are more feasible. Here, you're expected to be much more stable. Your role as a father and a husband are much more central to your identity, and tolerance for risk and risky behaviors really lowers a lot. Next slide, please. So what does a life course look like? And here I'm using an example from the work with the DHS in thinking about family formation. And here we were looking at a group of men who were, and looking at the timing of first sex, first marriage, and the birth of their first child, and trying to understand how these things were linked together. And we looked at the social timing. So there's a group of people who had the typical timing for first sex. There's a group who had it earlier than typical and later than typical. And as you can see, there's the majority of people stay more or less within the same trajectory. So if you're earlier to have first sex, you're more likely to be earlier to have first marriage and earlier to have the birth of your first child. And similar for later, and of course for typical. So we see that there's a lot of where you get started in the family formation process matters for where you end up in the family formation process, and that matters for a huge amount of other things. So the determinants of these processes in the timing really matter a lot. While there is a lot of what we would call path dependence, people staying on that same trajectory, there are also lots of examples of people moving from being in a typical timing to being in a later timing and earlier. So there is a lot of diversity, but a lot of continuation throughout. And that's just one example of what we might see thinking about it from a life course perspective. Next slide, please, Dominic. So if we're linking the male life course needs to programming, we could see how the life course allows you to think about people's needs in various different ways. You could think about the pressures that men have and how you might help with those pressures in a given life course stage. So perhaps seeing that there's a lot of pressure for being able to perform the role of provider for young men, and that seems to be a transition that is very difficult in certain circumstances, might lead you to focus on interventions that will help in being able to do that. Vocational training, other things like that. But it also allows you to think across the whole of the life course and think of how intervening early might have long-term implications. And it also is the perspective of thinking of thematic areas across the entire life course. So you might have economic need, you might have health needs, how those vary at different points in time matter on life course. And it really helps us to think about how can we prepare boys and men for different life course transitions and stages, and how can we alleviate some of these tensions. But I think also a key aspect to not forget here is that we need to not forget that the norms of masculinities, which are the key drivers of how life course stages are defined for men, and the needs within those are socially defined. Those can be changed as social definitions change. So programs should be aiming to redefine masculinity in ways that help men deal with this, and incidentally help women, of course. It requires a lot more attention to social norms and thinking about these things than we have done so far. And I know I'm slightly over time, but I want to take just 1 minute to talk a little bit about the example of COVID, which I think is a very interesting thing to look at from a life course perspective. If you think of COVID, there's one aspect is it clearly affects people at different life course stages in different ways. We know that mortality and morbidity are highest for people in the older adulthood life course stage. They have very specific biological factors that matter for how the COVID epidemic is affecting them. But we also know younger people are more likely to be exposed and more likely to be at risk Why? Because they are in the roles that expose them, through work, through social interactions, through other ways, more so than people at a different life course stage. We also can look at this as, what is the effect of this moment in history for young men versus older men? And we could see that there's a group of adolescents and younger men whose transitions are going to be delayed or stunted by the fact of shutdowns, the economic damage, all these other things that have come with the COVID epidemic that will cause lifelong effects. So having an interruption in schooling now may result in ending schooling. It may result in poor opportunities. It may result in lower income. And those things are not easily reversed. That matters for where these people will be in 20 or 30 years. The scars of this pandemic will be borne for a very long time. And those are things that we need to be thinking about for this particular generation who are living through it. And it matters which life course stage they're at as to how they're affected. So if you can just go to the next slide, Dominic, that's the end of my presentation, a very whirlwind take through the life course perspective, but I hope that it's been useful in terms of just thinking through how this might apply to programming and to thinking about working with men and boys. Thank you very much.
That's great. Thank you, Jeff. And again, I'll give a second plug for the resources too. They provide, if you read the life course theory original documentation, it's very heavy and challenging to go through. These resources, specifically the typologies and the life course opportunities for gender transformation, do a nice job of summarizing that for you and putting it into giving a little bit more context as it relates to the work that we do. And so, yeah, definitely want to encourage people to check those out and consider them more in their work and in their conversations. We're going to open it up to question and answer session. At this point, I'm going to stop sharing my screen, and I'll be able to see some of the chat, and maybe there are a few questions in there that have been we want to identify and then kind of move on. Yeah, but let's start it off by, I'd like to ask all the panelists, Faisal, Rachida, and Jeff, if you, we called this session is timing everything. And as you think, I heard several different pieces of where timing and kind of time of life come into play in terms of the interventions that were talked about and in theory around life course. If you wouldn't mind starting us off, Faisal, would you talk a little bit, and then we'll go to Rachida and Jeff to kind of give a little wrap up of that too. But where does timing kind of come into play in terms of, the timing of the audience in Faisal's project, or those individuals in Zambia who are coming in for the service? We saw different ages, but Faisal, if you talk a little bit about the timing for the audience in your intervention, that would be great.
Thank you. You want timing of the program on air or the live?
More like the audience, so their ages, and who, you talked a bit about, the target audience for the shows, and why the messages were salient to those particular audiences.
Okay, thank you. So main target audience, as I said that, okay, it's a bigger age bracket. It's between 15 to 45 years of men and women and other members of the family. And within that age bracket, if we want to narrow it down, it is actually in between 18 to 35 years, because in many of the cases, they are going to be the change makers, but they are greatly influenced by the older population. So if you see in different dramas, we had different age group as actors, and in the storyline was weaved in that way to attract different age group. And one important thing was why we were targeting the young people. that young people feel that, okay, they are at less risk of having COVID, and they do not follow the restrictions and the instruction by the health and other departments. At the same time, they are also the change makers in terms of like male participation and addressing the gender equality and gender-based violences. So in our case, the younger population was the main target audience of the dramas. So we also brought a lot of young characters in the drama.
Yeah.
Thank you.
Thanks, Faisal. Ruchita, do you want to talk a little bit about the users and timing? You gave some statistics about who came, but maybe there might be some anecdotal or other dynamics around that from the work.
Oh yeah, most definitely. So we get to work with adolescents 15 to 19, but adolescents in Zambia can start as early as 10 years old. And that was kind of a limitation of who we can work with, who we can engage, and the IRB allowing us to engage them and actually, programming for them, especially once, family planning and sexual and reproductive health. That is a tricky topic to convince anyone in the community to let us talk to someone who's 10 years old. So we definitely focused on just a subset of the group, and timing was really important, again, given, the data of when they first start having sex and the high rates of adolescent pregnancy and just the fertility rate. I think starting early, as you said in your do's and don'ts, is really important. And one of the things that I would definitely point out is that for our men's group, the 20 to 55, it's a really wide range. And we acknowledge that it is a limitation of a project that has a limited amount of time and needs to categorize men or our audiences into larger buckets. That's one of the missed opportunities, to not actually get into the nuances of that wide range, age range with men. But I would say we definitely took advantage of sort of the social role and provider family role. And that had timing involved in it just from implementation itself. We engaged fathers who had children under 5 years old to talk about nutrition. We're trying to get them engaged when their children are still young, so that would follow through as they have even more kids, or, their kids grow up. Their involvement with the family and the family's health will remain, we can hope. So timing definitely, I think, as Jeff pointed out, throughout the life course, I think as things evolve and people take on more roles socially and within their families, I think those junctures are critical in programming, for sure.
Yeah, Jeff, do you want to either kind of put a little bit of the context to this, to the theory, or I think you might even have a couple other questions for these guys as well.
No, I think Ruchita, you segued nicely into what my next question really was thinking about, in terms of the social expectations for men and boys at different life course stages, and how that mattered for how you approach them. And I think, Dr. Faisal, I'm interested too, whether you had mentioned as well that there are some groups who are particularly influential, or there are some groups who you see as being hubs for families or other types of activities. And so I'm wondering, in thinking about it from a life course perspective and how social expectations matter for certain behaviors, are there ways that you took advantage of them? I think, as you really laid out nicely there, Ruchita, where you can take advantage of the social expectations for providers to find points where men are more receptive to messaging, because it aligns well with those expectations. And I'm just wondering if there were other examples of that type of thinking in your programming that you were able to take advantage of.
Is that directly to me, or should Faisal go first?
I think to both of them, both of you, sorry.
I'll let Faisal go first.
Thank you. I think it's critical for us. What we intended to do is our main intention was starting from the very beginning. Apart from this, we also wanted to bring the directors and writers on board into the whole process. As you see, that in our process, we also brought the script writers and the directors into this. And actually, our main intention was that to bring the specific time period they are passing during the COVID situation. So we didn't go further, we didn't go back. Rather, we tried to link it with the future intervention. For example, in the price of stupidity, we see that, okay, it goes beyond the COVID period, and later how they are spending their times and others. So we stayed on a single line during the whole COVID period. But in one or two instances, we went further. Thank you.
Yeah, and I'd like to open it up to individuals in the audience who are interested to ask a question. We have a lot of chat in here. I'm trying to skim through some of the questions. One of them was from someone we know named Afifa Abdurrahman, who asks, what were the behavioral objectives? And I think, kind of we can talk to either of the interventions, and how do you reflect the do's and don'ts into the messaging? And also, what types of gender transformative approaches did you use? I think this might be a little bit more focused to Faisal, but I think it's relevant to both projects. If you guys want to talk about some of those behavioral objectives, and then also how it kind of fits into the transformative, gender transformative approach.
Dominic, if you don't mind, I'm going to tie in Jeff's question to
I'm sorry about
question
that
as well. No, it's totally fine, because as I was formulating my response for Jeff's question, I think it ties into gender transformative approaches. So personally, I am a firm believer in gender transformative programming, and we had men's role as providers for their families honed in from the very beginning with the gathered evidence. I'd say I would like to have taken it a step further in getting men to be more actively involved in their child's nutrition and even care seeking for their illnesses. What would a family health day, for example, look like, where we can get men and women to come for their services while they bring their child along and are also able to seek services for their children? Now, especially when it comes to normative ideas of access around family planning and promoting, this idea that it promotes promiscuity in adolescence, or it promotes engagement in transactional sex. We were able to address those at the facility level with provider training for the wellness days and the confidentiality pledge. But I think I'd say those norms and ideas were not quite addressed at the community level from what we heard from small but not insignificant accounts of people still critiquing our programming to point out that it may promote promiscuity or promiscuous behavior in adolescence. Most interventions, if not all, target young girls, but seldom include or focus on boys, exposing them. So we thought it was really important to expose them to the thinking that prevention of unplanned pregnancy is the responsibility of both partners. Early knowledge about reproductive health choices were seen to be important in behavior formation. And these boys would hopefully then grow up to be men who discuss family planning with their partners, an ideation factor that increases the likelihood of family planning use, we've learned. In terms of how we approach them and the whole social understanding of men and boys' roles, I think the social dynamics definitely informed how we approached them, what we discussed, and ultimately, but not entirely, what we focused on. Especially for adolescents under the age of consent, parental permission is required to be able to engage them in our research, and that may be limiting when certain parents may think that adolescents should not be talking to anyone about family planning and sexual behavior at their age. There's also the divide between the social understanding within some of our country contexts of the roles men and boys at certain stages of their lives take on, and between what the data tells us their roles as social actors look like and the implications of those health behaviors. This goes back to Jeff's point about age having a socially constructed component as part of the lived experiences of individuals. I do think it's a balancing act when doing research and even programming. But I do believe that we shouldn't limit ourselves, and we should definitely use evidence ultimately to push the boundaries on some of those social expectations and roles.
Okay. Yeah. So, Faisal, can you? Sorry to kind of jump in again. Are there any other questions from the audience, and then we'll circle back to what I was asking. We have about 8 minutes left. I don't see any hands. So yeah, just kind of, can you talk a little bit about the gender transformative objectives, like kind of the behavioral objectives related to the television shows, Faisal?
Sure. Thank you. But before going into that, I would like to share that in the chat box, I have shared one link which incorporates all our materials during the COVID period. So it includes the radio programs, it includes the TV dramas, for all the TV dramas, like social media products. It's quite a lot, around 200 materials are there. So whoever feels like, feel free to go into that link, and you can watch this. I would like to share here that, okay, the norms we wanted to address are, number one, that it's not only men who can play an important role in combating the COVID situation. As I was mentioning that, okay, we took a thin linear time frame of during the COVID period. Bringing this issue. Number two, it is often thought that, okay, only men can make the changes. So men are important, while women should also taken into consideration. This is number one. Number two issue we wanted to address here, that, okay, the COVID situation did put not only women into the difficult situation, men are also facing difficult situations. So this norm that, okay, men should only be the sole earner for the family in many of the cases, this was also addressed. And like in terms of GBV and gender equality, we did address most of them. Different role models in men and women was also portrayed. So the changes we wanted to bring in terms of norms, that it's the couple communication are important, and it's the it's our the society is for the men and women, not only for the men or not only for the women. So we all have these similar roles. So that's what we wanted to discuss.
Okay, Jeff, any last comments before I'll wrap it up here?
Well, one comment I had is on the question about whether these interventions need to be explicitly gender transformative, or whether it's enough in some cases to be gender sensitive. So, I mean, I think in as much as we believe that gender transformative processes are beneficial for men and for women, we should always be striving to be gender transformative. Realities means sometimes that's a pretty high bar. And so I think we also need to be understanding of when programs are more gender sensitive than gender transformative. But I do think that if we think of need and of stress and of other pieces as at least partially the reflection of being unable to perform social roles, then that helps us think about why it's important to change those expectations, and why we might be able to reduce stress, why we might be able to lead to a more equitable outcome for everyone if we're focused on transformation rather than simply being aware or sensitive. But I think it's a high bar in many cases to be fully transformative, but there are always opportunities to try to push the envelope and push things forward that I think we should always be taking advantage of.
Mm-hmm. I'm going to actually use one of your slides, Jeff, to attempt to articulate one of the points I was trying to make earlier. And that is, as we think about reaching all men, and you think about this slide right here, provides you with the context of why we don't reach all men. Not all men are in those, and women too, are in the same phase and going through the same transitions at the same time. As in this graphic, we may program for this 60%. If we're trying to reduce adolescent sex, or if we're trying to ensure that they're using protection against STDs or pregnancy prevention in that initial sexual intercourse, we may target that 60% and be relatively effective. But we're also going to miss several people who are going to come along later, as well as those who've already started. And so kind of as we program, and you can see, and as Jeff was pointing out earlier, the ripple effects of only hitting the 60% is impactful over time because it does lead to other decisions. And how do we shape the programming to engage a wider variety of men and push ourselves to not only to reach out to them and approach them, but also to kind of tailor the messaging and the interventions to them. Social media provides us with an opportunity to, and this doesn't have to be the only way to intervene, but it is a very effective and high-reaching and a scalable approach with costs, but not as high costs as the face-to-face and carrying out. But the point is that as you develop these programs further along with using social media platforms or using technology platforms, how do you tailor them to these different audiences? And can you actually provide a more personalized intervention through technology or through a social media platform? I mean, we heard both that the television programming was integrated into different social media platforms and online reach, as well as Rachida talking through the Zambia activities and kind of making sure that, finding different ways to promote the men's wellness days, reaching a wide swath of men and adolescent boys. And so how do we kind of push our programs a little bit further to reach a wider variety of men and integrate them in different ways and tailor messaging to them, I think is something I'd like to push our field a little bit further into thinking more about, rather than testing things that are more the typical 60% that we reach oftentimes. Thank all our panelists today. I really appreciate everybody taking the time, not only today, but before leading up to today, investing in this series of presentations, managing and someone who's not on the screen right now, Danette Wilkins, who's been critical in organizing and putting this all together on our end, and also Men Engage and Ubuntu for hosting this. Has been a great opportunity to reach, looking at some of the names and some of the people around the globe who've been, who've tuned in today, and hopefully will tune in, and other people who will tune into the online version of this later on is really impactful. And I really appreciate you all coming out for what is the morning for us, maybe afternoon or evening for you, to listen and learn a little bit more. And please feel free to reach out to any of us for any materials, thoughts, ideas, suggestions. It's a pretty, our area of work is pretty open to conversation. So I want to encourage that and hope it continues on. And yeah, thank you all very much. We appreciate you coming out this, what is the morning for us here on the East Coast.